You're still watching the City of Lagos TV show. Welcome to Lagos Agencies in Focus. This is a platform where we zero in on strategic agencies in Lagos. And of course, we are all aware that there are agencies that mean so much, especially to Mr. Governor Babajide Sanwo-Olu. But let's start on this note that prevention and control of HIV/AIDS is a global responsibility driven by collective, deliberate, conscious, and articulated strategies and efforts to attain and achieve quality life for citizens. In Nigeria's foremost commercial nerve center, talking about the city of Lagos, the advocacy to control and prevent HIV/AIDS is phenomenal. That brings to light our agency in focus, talking about the Lagos State AIDS Control Agency under the office of the governor, and of course under the able leadership of Dr. Folakemi Animashaun, who happens to be Chief Executive Officer of the agency. Madam, you're welcome.
Thank you for having me.
It's a pleasure to have you. And of course, first, just on a lighter note, this is a very strategic agency, and a lot of stakeholders and Lagosians would like to know, who is Dr. Folakemi Animashaun? Just a brief profile of your background and, of course, your personal profile.
My name is Dr. Folakemi Animashaun. I'm the Chief Executive Officer, Lagos State AIDS Control Agency. Lagos State Control Agency is the leading and coordinating agency for HIV response in Lagos State. I'm a medical doctor by profession. I'm a graduate of Olabisi Onabanjo University, formerly Ogun State University Teaching Hospital. I'm also a public health physician. I did my public health from the University of Essex in the United Kingdom. I also did my strategic management and leadership with the Metropolitan School of Business Management in the United Kingdom as well. And I also have a master's in public health background, master's in business administration background with the University of Chichester, also in the United Kingdom. And aside from my professionals, educational background and all that, I've been with the civil service the last 15 years as a medical officer, also with the Lagos State, from the Lagos State Ministry of Health at the staff clinic, where we attend to the staff within the LSACA environment, and then we do referral. From there, I was posted to Directorate of Planning, Research and Statistics, where we developed so many policies and programs, for the state. And from there, I was posted to Ministry of Special Duties and Intergovernmental Relations, where we also work with different agencies. So we work with LSACA, the Fire Service, the Safety Commissions under the ministry. And from there, I was posted to head the Command and Control Center. That's the emergency center in the state. I'm also under the Ministry of Special Duties, where I changed the narrative of the Command and Control Center before the recent appointment of the new General Manager of the Command and Control Center, and where I was appointed in 2023 as the CEO of Lagos State AIDS Control Agency.
That was a very fantastic profile. Now, let's come to the agency itself. What is the mandate, the vision and mission statement of LSACA? And what are your core values and key functional responsibilities in line with the Themes Plus agenda of Mr. Governor?
Thank you very much. Let me start with how LSACA is established before I go into our vision, our mission, and our mandate. LSACA was established in 2001 as a foundation. It wasn't even LSACA. It was HIV and AIDS Foundation under the former governor of Lagos State, Asiwaju Bola Ahmed Tinubu, now the President of the Federal Republic of Nigeria. So this foundation now metamorphosed and evolved into what we have as LSACA in 2003. In direct alignment with Themes Plus agenda of Mr. Governor, Mr. Babajide Olusola Sanwo-Olu, LSACA vision, our mission, and our mandate are deeply embedded in the broader aspiration to build a greater Lagos with a critical role in the health and environment pillar. Lagos is the first state to actually have an HIV foundation and an HIV response agency in the whole country. So we lead and coordinate the mandated comprehensive and inclusive response. So it's a multi-sectoral HIV and AIDS response. That means that we work with different line ministries. We are not just ordinary health-focused agency. We are a strategic facilitator, a policy driver, and a development partner agency at the same time. So I'll now go deeply into our mandate. Our mandate is to lead and coordinate the control and prevention of the spread of HIV and AIDS in Lagos State. When we are looking at this mandate responsibility, we say that we coordinate the HIV response across government agencies, private sectors, civil society, and at the same time, our community structure. We develop and we also operationalize policies, strategies, guidelines that govern HIV prevention, treatment, management, and support. We also mobilize and also harmonize resources, both technical and financial resources from local and also international development partners. Our mission is to reduce the incidence of HIV in Lagos State, mitigate its impact on both infected and affected people. That means that people living with HIV, they are not alone. When it comes to our vision, we are looking at a state with low incidence of HIV and AIDS, where the whole community is involved in its prevention, in its management, in fighting against HIV, and also ensure that people can live and interact freely in the state. A state where there is no stigma, a state where there is no discrimination against people living HIV/AIDS. When it comes to our core responsibility, we're ensuring integrity because we need to be transparent and also we're accountable for every action. Collaboration is part of our core responsibility. It means that we collaborate with different agencies, parastatals in the state, international and local partners. We ensure equity, right to live, and right to health. And also innovation, leveraging on new technologies. We are working on how LSACA website will be more interactive, not just any other website. A website that I can quickly go online. Where is the nearest location for me to access care? Where is the nearest location for me to get my medications or to get HIV testing and counseling services? And at the same time, empathy. We usually extend love to them during this period, and also in respect of human rights, which is very important. That means that we protect the dignity of every individual, irrespective of their gender status or their health condition when it comes to HIV/AIDS.
Let's look at your strategic master plan in order for you to be able to meet up with expectations.
The strategic master plan of LSACA is actually built on a robust and a multi-year planning. We have some plans already in place that we either adopt or adapt, like maybe the National Strategic Plan by the Federal, because we have to follow some documents in place when it comes to HIV response. Then we also have the Global AIDS Strategy. We have the Political Declaration on HIV and AIDS. And from our own end, when I came in 2023, we actually signed in the 2021 to 2023 plan. And presently, we are working on from 2024 to 2027 plan. And this plan is something that prioritizes sustainability, equity, and also local ownership globally. There is building in when it comes to funding of HIV response. So it's now high time for us to look deeply, to look inwards, how we can ensure the sustainability of LSACA, even if there is no funding again coming from international partners like what we are seeing now. We should be able to ensure that our network are still getting the antiretroviral drugs, continuity in our HIV testing and counseling services, continuity in condom programming, and so many other things that we are doing with or without the partners. So this plan is something that encompasses so many things, and in the next a month or two, we should be able to disseminate the strategic plan that we recently work on. And this plan has different pillars. We have pillar 1 that actually maximizes the equitable and equal access to HIV services. That means that we are trying to scale up our HIV services from what it used to be. Innovative approaches like self-testing kit that we've been using in the last 2 years now. That means that you don't have to come to the hospital to check your HIV test. You can get the oral test kit that you can follow the instructions, carry the test on your own, then you get the test results. And at the same time, expanding our pre-exposure prophylaxis and post-exposure services, particularly among the key populations and also the adolescent young girls, and increase access to antiretrovirals. That means that we want to ensure a situation where key population will be able to access ART and avoid stigma and discrimination. Okay, I don't want to go to this health facility. They'll say I'm HIV positive and all that. So through the one-stop shop, that's the OSS shop, they'll find their peers there and they're comfortable going there to get their antiretroviral drugs. And then also, importantly, prevention of mother to child transmission, which is the pillar one of that strategic plan. So for the pillar two, we want to break down barriers in achieving our outcome. We want to break down stigma. We want to break down workplace policy stigmatization, workplace policy discrimination against people living with the HIV. We want to engage young people to ensure that they understand more of prevention of HIV rather than getting infected and looking for how to manage themselves. And when I talk about the pillar three, resources, we need funding. We need to sustain an efficient HIV response. We want to reduce donor dependency and increase government ownership. And at the same time, we want to integrate HIV services to all our existing programs like Ministry of Economic Planning and Budget. They talked about the social protection system. So now we are integrating into that phase at the same time. And then lastly, I would say that we want to strengthen our coordination mechanism at all local government levels. We want the chairman of every local government to be involved in HIV response. So all these things is going to be embedded in the new strategic plan.
So, Madam, since you came on board as the Chief Executive Officer in 2023, what are the significant, very progressive, result-oriented initiatives, programs, projects? We just wanted to encapsulate and capture very significant achievements made so far.
Thank you very much. Since assuming office in 2023, LSACA, under my leadership, we have recorded a significant result through our strategic planning, our evidence-based program, and also a strong stakeholder collaboration. We've developed the sixth HIV strategic plan, like I mentioned earlier. We have strengthened our real-time HIV data tracking through the state HIV dashboard for better decision-making and also program accountability, so we can have an accurate number of people living with HIV in the state. We expanded HIV testing and counseling services to over 1 million through our community-based campaigns during the state event, like during the World AIDS Day, the Council Conference, Public Service Week, May Day, our Market Women programs, religious programs, and all that, and so many organizations that write to the agency. We provide free counseling testing services to them. We have reached well over Lagosians through our multilingual messages on radio stations and all that when it comes to HIV in Hausa, Igbo, and Yoruba. We've done that as well. We've also trained and we also engaged key community influencers like the traditional birth attendant. We've trained over 400 since I resumed office on skilled birth, and again when they have HIV patients, what they need to do when it's time to refer and ensure that a new child that is coming into this world must not get infected with HIV. We've also supervised all our one-stop shop across the center. Like we have the 14 one-stop shop, which is actually being managed by our key partners. We've also educate Lagos State Office of Disability Affairs in Lagos State, because we believe that being vulnerable or being disabled in any aspect should not be a reason for you not to know about HIV in the state. So we've trained over 400 as well, and we are going to do in another couple of weeks. We are expecting from them to forward the list of the next batch that we are going to train and we are going to educate. And I need to mention also that Lagos State is the first state and still the only state that actually translates HIV information into brailles for the blind, so they can read and also understand about HIV. And also we've empowered over 100 people living with HIV during our last World AIDS Day. We empowered them with equipment, grinding machines, tailoring machines, and all that based on self-discrimination at workplace. So some of them, they don't really want to, do a formal work. So we actually invest in them And we also provide financial assistance to the 50 and above in that network. We have tested over 7,300 individuals through our PMTC program, that is Prevention of Mother to Child Transition Program. And we also enrolled the positive one into care. And we've also developed the gender-based violence and HIV document. This document actually speaks with the intersection between gender-based violence and HIV. Yes, there is Agency for Domestic and Sexual Violence in Lagos State, where they're doing a fantastic job. But when it now comes to a domestic and sexual violence that has to do with HIV at the same time, so that is where we come in. So we are working together, and we've actually developed a document that actually speaks to that, and it has been disseminated also within the time frame I resume office. And I also say that we've also received some experience sharing section from other states that came to Lagos to understudy what we are doing right. We've received delegates from Taraba, we received from Kano State, and we've also even received from Kenya. Yes, I received the Kenya team sometime last year. They came for how Lagos State is doing the condom programming right and all that. So
it's obvious you have local and international partners. So what is the level of synergy, relationship, collaboration between the local and international partners in order for you to sustain your set objectives?
Let me start with the local stakeholders. I mentioned earlier that we have some line ministries according to our law. So let me say they are our local stakeholders. So we have 11 line ministries for the state, so which include the Lagos State Ministry of Health. And then Lagos State Ministry of Health will have the SAFSCAP, so that's the State AIDS and STI control program under Ministry of Health. So they are key major stakeholders for us. We have the Ministry of Justice. So Ministry of Justice will come into place like when we have a case of gender-based violence and HIV intersection that needs to go to the court. We have Women Affairs and Poverty Alleviations. We have Ministry of Youth and Social Development. We have other civil society organizations as well as our local stakeholders. So which includes, we have the NEP1, that's the network of people living with HIV/AIDS. We have NINETA, we have Ashuan, we have CISAN, we have APINE, and all these are our local communities stakeholders, as well as all our religious leaders, because we've trained over 200 religious leaders since my assumption in office, because we want them to use their platform to educate people on HIV. So our donors are multilateral organizations. We have the UNAIDS, we have the UNICEF, the UNFPA, USAID, we have PEPFAR, we have Global Fund, and for our implementing partners, we have the Atlant Alliance. Fine, they've metamorphosed into ECWAS, some parts because of the US government's new rules and the rest. So we have the CIHP as well. So these partners, they assist us, they enhance our access to services to improve technical capacity and also promote sustainability through joint planning, collaboration, and also our shared accountability when it comes to HIV response in this state.
You're still watching Lagos Agencies in Focus, and we've been speaking with the Chief Executive Officer of the Lagos State AIDS Control Agency, LSACA, Dr. Folakemi Animashaun. To a great extent, it's very clear that this is one agency that has lived up to its expectations despite challenges, and it has also been able to bring to bear the very important value of HIV/AIDS control, and of course, very significant achievement so far since she came into office in 2023. And so, Madam, let's look at statistical data, because when you're running an agency of this nature, one, you must leverage on data, and two, you should have verifiable data, and of course, the ability to also gather data. This will help you to achieve your set objectives. So, can you give us statistical data, an appreciable picture of Lagosians that have benefited from the services or the mandate vision of the agency? And how have you leveraged on information technology?
As at the end of 2024, we have about 135,224 people living with HIV in Lagos. 135,224 people living with HIV in Lagos State. And I would say about that numbers are currently on antiretroviral therapy in the state. So that means that we have most of these people linked to care. At the end of first quarter of 2025, according to the most recent surveillance data under ENDAS, we have 2,227 new HIV infections in the state, first quarter of 2025. If you look at it, we say it's quite high. And for this set of people at the same time are also linked to care. We have about 62.7% of this number, they are females. And 8.7% of these same numbers are adolescents and young people, so the rest are male. And then to a very large extent, we've achieved at least about 79.5% viral suppression in this set of people. So we are getting there. It's not what it used to be. We are ensuring that people are getting the right information, right messages about HIV/AIDS. And leveraging on technology, through the Public Affairs Office unit, we ensure that every week we release messages on HIV in the state through all our social media platforms. We do occasional press release as well. We also ensure that our surveillance in the media is quite high. When we are seeing some messages or when we are reading some messages that is false about HIV, we tend to come out and debunk the such viral messages. I mentioned about our website initially, earlier in our conversation, and we want to leverage on the power and the strength of social media in the next couple of months and also in all our doings, because we find out that the target population that we are looking for, most of them are on social media, and that is the only way we can pass the right information. So I would say we are there, but I can only say that surely we are going to get there. I'm very sure that our audience at home will want to know more about the Lagos State AIDS Control Agency. We are at 1 Broad Street. We are located within the premises of General Hospital, Lagos. Do you want to ascertain your HIV status? You can visit any of our designated hospitals within the state. All general hospitals and all health centers are willing to help to check your HIV status. It's seamless and is also confidential. And if you need more information about HIV, then you can then follow us on Instagram, LSACA_NG, on Twitter at LSACA_NG, on Facebook, Lagos State AIDS Control Agency. And you can also give us a call or drop a message on our WhatsApp pages on 090-224-81384. Thank you.
Thank you very much. It's been a wonderful time speaking with you. But again, as an agency, there are likely challenges. And so what are the challenges faced by the agency? And what have you been able to do to actually mitigate against them?
Thank you very much. There is no how we talk about our successes without talking about our challenges. I'll say one of our major challenges is the growing population of the state, the ever-rising Lagos State. There is influx of people every day in Lagos State. These challenges has to do with people coming into Lagos not having the background of information of HIV. So it means that we need to continue, having the same information over and over again. So it's a major challenge, which we are actually looking at it by strengthening our community health system. That means that all hands must be on deck for us to ensure that people are getting the right message frequently. And I would say that there is persistent stigma. There is stigma and discrimination against people living with HIV/AIDS, and this often results in depression. We have a lot of people that are HIV positive that are being stigmatized at their workplace. Some, they refuse the employment following maybe normal medical fitness, and if they find that you're HIV positive, definitely you won't get the job. And the GBV HIV intersection guideline I spoke about earlier on, sometimes we look at this. We've invited some companies some organization to this office to meditate about why are you discriminating. Some of them will tell you that they don't have an idea, even after sharing the workplace policy law to them. And then, so stigma is a major challenge. And also, funding gaps. We are at the area of reduced funding from international and even local partners. And then sometimes when our international partners comes with some activities, if this activity is not something we have knowledge of before our home budget preparation, it's always difficult for us to have the counterpart funding or probably to support the program. They want to come up with an activity with a restriction of, okay, just 15 people we want for these activities. And this is Lagos. We know that we need more people, we need more stakeholders to come in. And so there's funding gap in some of these activities. So it is a major challenge to us.
There are obviously futuristic, laudable initiatives and plans, projections of the agency to accelerate HIV/AIDS control in Lagos State. So what are those futuristic plans?
We are looking at expansion of our community-led programs, our community-led monitoring and support groups, because the community is where most of these things is happening. And not all the people within the community have access to that right information. So it means that we need to strengthen our community program to outreach areas, ensure that they have specific information that will help us to achieve our mandate in the state. And also digital transformation of service delivery. That means that we are working on our website, and a website that would actually not just any other website, a website that when you have that information on, oh, I want to check the nearest facilities that I can access HIV testing. I want to access the one-stop shop or the community stop shop that I can get my antiretroviral drugs. A website that I can report stigmatization, I can report discrimination. A website that I can complain about a gender-based violence and HIV intersection. We are looking at the website that the people living with HIV, you can join a support group. We're also looking at a greater inclusion of our pre-exposure prophylaxis, a youth-focused services, and also a community where we can scale up the prevention of mother-to-child transmission. We're also looking at a futuristic initiative to broaden our domestic resource mechanism, which includes the health insurance linkage, which is actually ongoing, but at least to have more of the network of people living with HIV/AIDS who cannot pay to be linked under Lagos State Health Management Agency or Ilera Eco initiative that is already ongoing. So it's something that we are really looking into.
Fantastic. How would you describe the governor's support for this agency?
Mr. Governor, Mr. Babajide Olusola, I would say, let me say thank you to Mr. Governor, because Mr. Governor has actually demonstrated unwavering commitment when it comes to HIV/AIDS in Lagos State. When it comes to our budgetary support, our budgetary release, and a strong political will, we have that here at the Lagos State AIDS Control Agency. We have the inclusion of LSACA in cross-sectorial development. And also, we have the support also from the Office of the First Lady. They provide support for our networks, even during our last World AIDS Day. So we have so many support from every parastatals of Lagos State. So I'll say thank you to Mr. Governor, because Mr. Governor has been wonderful in the support of HIV response. It's more or less like the HIV response in the state is very close and very dear to his heart. So I'll say thank you again, Mr. Governor.
So on a final note, what's your word of appreciation to local and international partners, collaborators, words of encouragement to all the stakeholders and especially to Lagosians?
I would say a very big thank you to all our international partners, either present, past, or in the future, because we have some of our partners that are no more in the state, but they have helped the Lagos State HIV response in the past. So I'll say thank you to them. Those partners that we have right now, I'll say thank you for their technical support over the years, their financial support over the years, all our global partners, all our local partners at the same time. I would say a big thank you to all the communities, our community leaders, our religious leaders, our royal fathers, our CSOs, that's the community society organization, all our HIV networks. So I'll say a big thank you to them for their support over the years. And to every negotiant, I'll say thank you for not turning us down. Sometimes when we request, HIV testing is voluntary. So when we go out for programs and all that, they don't turn us down. I'll say thank you to every Lagosians. To every Lagosians, I'll still say, know your HIV status, stand against stigma and discrimination, take responsibility of your own health. Together, we can all end HIV and AIDS in Lagos. So thank you to all Lagosians.
It's been a wonderful time speaking with the Chief Executive Officer of the Lagos State AIDS Control Agency, LSACA, under the able leadership of Dr. Folakemi Animashao. It's been quite an impressive and well-detailed interview, leading us into appreciating and understanding the level of achievements, efforts, initiatives, and unflinching support of Mr. Governor to the agency. And of course, like you said, you can visit all their social media platforms to get more information about the agency.
Lagos.